Blood cancer, a formidable adversary, strikes at the very core of our life force, our blood. It disrupts the intricate process of blood cell production, jeopardizing the critical functions these cells perform. Imagine a well-orchestrated symphony suddenly thrown into disarray. That's what blood cancer does to our body's delicate balance. Our blood, a lifeline coursing through our veins, is not a homogeneous fluid, but a complex mixture of cells, each with a specific role. Red blood cells, like diligent workers, transport oxygen to every nook and cranny of our body. White blood cells, the valiant soldiers, defend us against infections, keeping diseases at bay. Platelets, the tiny but mighty repair crew, swiftly patch up any injuries, preventing excessive bleeding. Blood cancer disrupts this harmonious balance, throwing the production and function of these crucial blood cells into disarray. It's like a rogue element infiltrating a well-organized system, wreaking havoc and jeopardizing the very foundation of our health. This essay delves into the world of blood cancer, unraveling its complexities and empowering you with knowledge. We'll explore the types, causes, symptoms, and treatment options, emphasizing the importance of early detection and the promising advancements in research. Remember, knowledge is power, and understanding this disease is the first step towards conquering it. Blood cancer is not a monolithic entity, but rather a family of related diseases, each with its unique characteristics and challenges. Let's meet the three main protagonists in this complex narrative: leukemia, lymphoma, and myeloma. Leukemia, the most commonly known blood cancer, primarily affects the white blood cells, the body's defense system against infections. Picture a factory churning out defective soldiers, ill-equipped to fight off invaders. That's what leukemia does. It leads to the overproduction of abnormal white blood cells in the bone marrow, crowding out healthy cells and compromising the immune system. Lymphoma, on the other hand, targets the lymphatic system, a crucial component of the immune system that helps filter waste and fight infections. Imagine a network of communication channels disrupted, leading to chaos and inefficiency. That's lymphoma's impact. It affects lymphocytes, a type of white blood cell, causing them to multiply uncontrollably and accumulate in lymph nodes and other organs. Myeloma, the third member of this trio, focuses on plasma cells, a specialized type of white blood cell responsible for producing antibodies, the body's guided missiles against infections. Imagine an arsenal with faulty weapons, unable to defend against attacks. That's the danger of myeloma. It disrupts the production of antibodies, weakening the immune system and leaving the body vulnerable to infections. Each type of blood cancer presents unique challenges, and understanding their individual characteristics is crucial for effective diagnosis and treatment. The causes of blood cancer are often multifaceted, a complex interplay of genetic predisposition, environmental factors, and lifestyle choices. Like a detective piecing together clues, scientists are constantly working to understand what triggers these diseases. Genetic factors play a significant role in blood cancer development. In some individuals, mutations or alterations in certain genes can increase their susceptibility to these diseases. It's like inheriting a slightly flawed blueprint that increases the likelihood of errors during cell division and growth. Environmental exposure also plays a part. Prolonged exposure to high levels of radiation, certain chemicals, and toxins can damage DNA and increase the risk of blood cancer. Imagine a constant barrage of assaults on our cells, increasing the chances of mutations and errors. Lifestyle factors, while not always directly causative, can influence the development of blood cancer. Smoking, for instance, is known to increase the risk of various cancers, including leukemia. Certain viral infections, like the human T-cell leukemia virus, HTLV1, can also contribute to the development of specific types of leukemia. In some cases, previous medical treatments, particularly chemotherapy or radiation therapy for other cancers, can paradoxically increase the risk of developing blood cancer later in life. It's like a double-edged sword, where the very treatments that save lives can also have unintended consequences. While the exact causes of blood cancer remain elusive in many cases, understanding these contributing factors is crucial for prevention and early detection. Blood cancer, in its early stages, can be a silent stalker, its symptoms often mimicking those of more common ailments. However, being vigilant and recognizing the red flags is crucial for early detection and timely intervention. Fatigue, a persistent and unexplained tiredness that doesn't improve with rest, is a common symptom of blood cancer. Imagine feeling constantly drained, as if your body's battery is perpetually low, even after a good night's sleep. Frequent infections, another warning sign, occur due to the compromised immune system. Imagine your body's defenses weakened, making you more susceptible to every passing bug and virus, like a city with its gates left unguarded. Unexplained weight loss, a significant drop in weight without any deliberate effort, can also be a red flag. Imagine your clothes suddenly feeling loose, your reflection in the mirror showing a thinner you without any conscious effort to lose weight. Easy bruising or bleeding, even from minor bumps or scrapes, is another telltale sign. Imagine your skin turning into a canvas of bruises, even with the slightest touch, as if your body's clotting mechanism is malfunctioning. Pain in bones or joints, particularly persistent pain in the back or ribs, can be a symptom of myeloma. Imagine a constant, deep-seated ache, as if your bones are protesting, signaling that something is amiss. Enlarged lymph nodes, those small bean-shaped glands that filter waste and fight infection, can be another warning sign, particularly if they are painless and persistent. Imagine small hard lumps appearing under your skin, in your neck, armpits, or groin, like sentinels signaling an internal battle. Remember, these symptoms can also indicate other health conditions. It's crucial to consult a doctor for an accurate diagnosis if you experience any of these red flags. Section 5. The diagnostic journey. Unraveling the mystery. Diagnosing blood cancer is like piecing together a complex jigsaw puzzle, requiring a combination of tests and procedures to confirm the presence of the disease, determine its type and stage, and guide treatment decisions. The journey often begins with a simple blood test, a routine procedure that provides a wealth of information about our health. By analyzing the different components of our blood, doctors can detect abnormalities such as low red blood cell counts, high white blood cell counts, or low platelet counts, which can be indicative of blood cancer. A bone marrow biopsy, a slightly more invasive procedure, is often the next step. This involves extracting a small sample of bone marrow, the spongy tissue inside our bones where blood cells are produced, and examining it under a microscope for the presence of cancerous cells. Imagine a detective carefully collecting evidence from the scene of a crime, searching for clues to solve the mystery. Imaging tests, such as CT scans, MRI scans, and PET scans, provide detailed pictures of the inside of our body, helping doctors visualize the affected areas and determine the extent of the disease. Imaging tests are like high-tech surveillance cameras, providing a glimpse into the inner workings of our body and revealing any suspicious activity. Genetic testing, a relatively new tool in the diagnostic arsenal, helps identify specific genetic mutations that may be driving the cancer. This information is crucial for tailoring treatment plans and predicting the likelihood of recurrence. Genetic testing is like analyzing the blueprint of our cells, searching for specific errors that may be responsible for the disease. The diagnostic journey can be daunting, but it's important to remember that knowledge is power. Understanding the diagnostic process empowers patients to actively participate in their care and make informed decisions. Treating blood cancer requires a multifaceted approach. It's not just about one treatment or one method. It involves a combination of therapies tailored to each individual patient. This can include chemotherapy, radiation therapy, stem cell transplants, and targeted therapies. Each of these plays a crucial role in combating the disease and improving patient outcomes. Advances in medical science have turned blood cancer treatment into a beacon of hope. New therapies and drugs are continuously being developed, offering better survival rates and quality of life for patients. Clinical trials are an essential part of this progress, providing patients with access to cutting-edge treatments before they are widely available. Ongoing research is the backbone of progress in the fight against blood cancer. Scientists and doctors are tirelessly working to understand the disease better and develop more effective treatments. This research not only helps in finding new therapies, but also in improving existing ones, making them more effective and with fewer side effects. The impact of this research is profound, offering hope and new possibilities for patients and their families. Your path to wellness starts with understanding your condition and exploring the various treatment options available. It's important to work closely with your healthcare team to develop a personalized treatment plan. Remember, you're not alone in this journey. Support groups, counseling, and patient education resources are there to help you every step of the way. With the right approach and support, you can navigate this challenging journey towards wellness.